Next, we're going to do the abdominals, which are composed of the rectus abdominis, the exterior obliques, the interior obliques, and the transverse abdominis. The rectus abdominis will flex the vertebral column and tilt the pelvis posteriorly.
Hold on. Okay, so flexion, right? And if I'm laying on my back, it's going to tilt, or actually I can do it while I'm standing here, just tighten my lower and tuck my hips, pelvis underneath, okay? To get more of the lower fibers.
Okay. The external obliques unilaterally will laterally flex the vertebral column to the same side, and they will rotate the vertebral column to the opposite side.
Okay. Right external obliques, lateral flexion, rotation to the opposite side.
Bilaterally, they will flex the vertebral column and compress the abdominal contents.
Flex. Okay. Draw everything in.
The internal obliques unilaterally will laterally flex the vertebral column to the same side.
Yeah.
And they will rotate the vertebral column to the same side.
Okay, so internal obliques, lateral flexion, and rotation to the same side.
Bilaterally, they will flex the vertebral column and compress the abdominal contents. Transverse abdominis will compress the abdominal contents. That's what they do.
So the transverse, kind of more like a belt, wrap around, attached to the transversus spinalis in the on the posterior side. Okay. When I suck in, that's one of the main purposes of that. Okay, but also during heavy lifting, it helps to stabilize the spinal column for your back safety.
All right. So to palpate the rectus abdominis, partner is supine with her knees flexed. Locate the xiphoid process and the ribs just lateral to the xiphoid.
Okay, so she doesn't have a xiphoid process. Okay, so I'm gonna go down, I'm gonna be the midline, I'm gonna slide below, and then I'm gonna be on the last lower ribs, okay? So that right in here, go ahead.
Okay. And also locate the pubic crest.
Okay, pubic crest, I follow the belly button down till I hit boom. Okay,
Place
pubic
your
crest
hand,
right about here.
Place
Here.
your hand between these landmarks and ask your partner to alternately flex and relax her trunk muscle,
Okay.
her trunk slightly.
So
Do a
what Sue's
small
gonna
sit-up.
do is she's gonna tuck her chin and just kind of lift her shoulders up a little bit. And I can feel the abdominal muscles engage as soon as she lifts her head. Okay?
External obliques, we're talking about the left side here. Good. Your knees remain flexed. Lay your hand on the left side of the abdomen and lower ribs. Ask your partner to raise her left shoulder towards her right hip by rotating her trunk.
Okay, boom, right here.
All right.
Okay?
Palpate along the superficial fibers of the external oblique, noting their diagonal direction.
Okay, right.
And with the trunk still rotated, follow the fibers superiorly where they interdigitate with the serratus anterior, then inferiorly to the abdominal aponeurosis, and finally laterally to the iliac crest.
Okay, so cross this way.
All right. Next is the diaphragm, which is your primary muscle of respiration. It draws down the central tendon of the diaphragm, and it increases the volume of the thoracic cavity during inhalation.
Okay, so the diaphragm is a bell-shaped muscle. Attaches under the ribs all the way to the back, and it actually, some of the spinal muscles, the quadratus lumborum and some of the deeper spinal muscles run through the diaphragm. Okay.
Alright. And it also has a lumbar attachment to the upper 2 or 3 lumbar vertebrae, and a sternal attachment to the inner part of the xiphoid process. All right. So, with your client supine, knees are bolstered or raised. Locate the inferior edge of the rib cage, lateral to the xiphoid process. And lay your thumb pads just inferior to the ribs on the abdomen, and ask your partner to take slow, deep breaths.
So every time Kathy takes a breath in, my thumbs get pushed out. A little tender. Okay.
And then moving only as your partner exhales, slowly press and curl your thumb pads underneath the edge of the ribs. During inhalation, you may not feel the tissue of the diaphragm, but you will most likely feel its contraction as it pushes other tissues into your thumb pads.
So as she takes a nice deep breath into her belly, my fingers, my thumbs get pushed out. So the diaphragm during contraction starts like a bell, okay, and then as you inhale, it flattens, okay, getting pulled down, and that's why when you do belly breathing, proper diaphragmatic breathing, everything below kind of gets pushed out, forward, to the side, and even back.
Intercostals.
Intercostals. Slowly I turned. Okay, sorry.
Better known to carnivores as the meat on spare ribs. They are slender muscles between the ribs. Your external intercostals draw the ribs superiorly, increasing the space of the thoracic cavity to assist with inhalation. Your internal intercostals draw the ribs inferiorly, decreasing the space of the thoracic cavity to assist with exhalation. So with your partner supine, begin just inferior to the pectoralis major on the side of the rib cage. Working across the body, position your fingers in the spaces between the ribs. With one finger pad, isolate and palpate the tissue between the 2 ribs. Roll your finger along the rib space and palpate the short, dense intercostals that bridge the ribs. And then ask your partner to take several slow, deep breaths. Note any expansion or collapse in the spaces between the ribs. And you can then turn your partner prone or sideline if you want to continue to explore the intercostals.
So you can palpate individually. Okay. Mm-hmm. You can palpate individually with one finger, or you can separate your fingers and gently palpate multiple levels of between the ribs, intercostals. Okay. All right.
Serratus posterior superior
Okay.
and serratus posterior
So we're
inferior.
gonna have to turn prone, correct?
Yes.
Okay.
Do you have the blanket?
You wanna pause for a second?